how does this industry advance, become full-fledged commercialization, and how do you balance that with what I'm seeing right now is the capital markets side, and then, indigenous communities. It's like, how do you balance that out? TDR on location in Denver, Colorado, the MAP Psychedelic Science Conference. Good to be here. Anthony Verrill from TDR. Good to see you, sir.
Good to see you in person for once.
I know. It's been a while, right?
Great.
Not a bad setup. And obviously, it's great to see you, Dr. Jeannie Fontana. How are things?
Great. Thank you. It's lovely to be here.
I know. So a lot of our viewers are going to probably ask who you are, what your mission is, main objective, why at the Psychedelic Conference. So let's first tee that up, because I know that you've drawn a lot of interest amongst people at this conference with speaking and people speaking to you and what your main objective is here. So what is that?
So we've launched the Treat California initiative, which is a citizen-driven ballot initiative in California to create a sustainable funding agency to build the psychedelic ecosystem.
Okay. So maybe elaborate more. Like where does you see this going, and what's the main initiative that's happening in California right now?
Well, I think it would probably help your listeners to appreciate where we came from, to appreciate where we're going. So I've been involved. I'm a neuroscientist. Got involved in ALS research about 20-something years ago when my mother was diagnosed. And at the time, human embryonic stem cells were just discovered. There was promise for what stem cells could do for developing drug discovery as well as understanding diseases in a dish. George Bush put a moratorium on funding of embryonic stem cells for political reasons. But there was a force of nature here in California that said, hey, wait, we the citizens of California believe in the research potential of stem cells, and so got the citizens of California to support a citizen-driven ballot initiative.
Right.
And it was passed in 2004. I was involved in the campaign with a yes vote by the citizens of California that approved a $3 billion funding agency.
Wow.
It was the first of its kind in the country, and that's which is why most people don't really know about it. So if you weren't following stem cells, you wouldn't pay attention to it.
So you have a track record with this. So do you think it's achievable?
Yeah, so I want to share more of what we were able to do. So we were charged with delivering on the campaign promise, which was bringing research to therapeutics. Okay. And you know anything about drug discovery, you know the cost and the time and all this. So we were, by the end of 15 years, we had 2 FDA-approved therapeutics, 9 fast-track and breakthrough therapeutics, and importantly, 60 compounds in the pipeline deserving of further funding. So the citizens of California approved an additional $5.5 billion in 2020. So in addition...
5.5 in 2020?
So it's $8.5 billion of a state funding agency. Taxpayer dollars do not go up directly. The funding comes from the sale of general obligation bonds, whose interest is amortized over decades, which we believe is proper because it's the generations behind us that will really reap the benefits from these therapies.
Anthony, you want to wrap?
Yeah, so with the funding agency, does that work kind of like a public-private partnership, or like what does that look like from the capital formation?
So we are introducing a true public-private partnership in our initiative. It's not standard in other ballot initiatives. The reason why we're launching a public-private partnership within our initiative is because we believe in order to build a sustainable ecosystem, we have to embrace finances, the financial world. So it has to be cost-effective, and we want to support the derivation of new therapeutics, right? So for instance, let's just give the example of LSD, whose half-life is 10 hours. And right now the medical model is, you have talk therapy before, then you have maybe 1 or 2 sessions with the medicine, and then multiple talk sessions afterwards. That combination right now appears to be the most effective. So, but that's time consuming. And if people, let's talk about working moms. Can they really take off a full day from work? They've got 5 kids at home, and how they do that, which we are accommodating for that in our proposal, in our agency. But what we think is if industry can develop the next gen derivative, let's say LSD, whose half-life is half an hour. And we go through our due diligence to decide that that company's product is worthy of validating and verifying through our infrastructure. We will pick that company and validate and verify their product through our clinical trial paradigm. So if we find that it is as safe and as effective as the natural state of it, we will help them get FDA approval.
Okay.
So in essence, we're acting like a VC or PE, private equity or venture capital, because we are picking a company and we are saying we want to invest in your product. The difference between us and a private equity firm is that we are not taking a lot of equity position in your company. What we will, terms to be finalized will be, we'll take a standard licensing fee of 5 to 15%. I want to maybe consider a flat revenue tax.
Okay.
And for the first time in our country, I'm writing in the legislation that the state agency can own equity in a company. Now, why are we doing this?
How's that work?
We're doing this for two reasons. One is we understand that it will be cost intensive to build the ecosystem, because we also want to make sure these medicines are accessible to all, regardless of ability to pay.
Okay.
So we feel that over time we'll be able to show that it's cost effective to society, right? Because you're not giving a pill every day. People could go to work. They're staying out of jail. All these kinds of things. So,
well, I learned last week they were saying the healthcare system here in America, it costs the healthcare system close to $20,000 per year for people with PTSD.
Now, these are guesstimated numbers. The U.S. government spends $820 billion a year on substance use disorder. And if we extrapolate that to California,
that's a crazy
it's not
number.
working.
California, we spend $95 billion a year just on substance use disorder. So if we can come in with psychedelic-assisted therapy in the right model and address 10% of those people, look at the cost savings for our state. And
at
then
10%.
At just 10%. And I think that's a conservative, reasonable estimate to come in at.
So I asked the question before, but how realistic is this? Because you said you have a track record. You had a stem cell treatment, a government grant. How much was it for again?
The state funded $8.5 billion.
$8.5 billion. How much are you looking for with psychedelic research?
Our agency will be funded by $5 billion.
$5 billion.
Yeah.
How does that work? Like, how does that play out? Like, what are we looking as far as a timeline for something like that what do you need in order for that to happen?
So first of all, we qualify for the ballot, of which we need help. We need 1 million signatures of registered voters in California. We have to do it by the end of the year.
Okay.
Then we are an official proposition and we get on the ballot. And then the citizens of California will approve either yes or no on our initiative.
Oh, wow.
Okay.
We assume it's going to be a yes. Polling shows that we're already in the high 60 percentile. Once we are approved, then the Treat Institute is formed, and it's an amendment to the California Constitution.
Wow.
So the legislation that we're submitting will change the California Constitution. So what does that mean? So we'll be funding programs focused on treatments, research, education, access, and therapies.
What's that do for the industry then, right?
Everything. It builds the entire ecosystem. So think about us as the tide, and there's a lot of different boats. Some are big freighter boats and some are small little dinghy boats, but we are the tide of which all boats will rise. So we are seeing ourselves as creating a mechanism by which we can thoughtfully, responsibly, safely bring forth these medicines to the public, starting in California. California is the 4th largest economy in the world. We are trailblazers. We are leaders. We built the ecosystem for stem cells, which now brought additional $26 billion in outside revenues, created 80,000 jobs.
80,000
jobs in addition to the therapies that were already...
So how much of an influence is that what you did prior to what you're doing now? To go back to my question about how realistic is this?
I believe that, the team that I'm pulling together, really experienced professionals, that one, we qualify and we get on the ballot and we get a yes vote. Then so that's part of Prop 71, the stem cell initiative. That's what we did. And then once it was passed, then we pulled together and we have a board and we are mandated to deliver on the campaign promise. And in this case, it will be on bringing therapies. We have to do data, science, clinical trials, large scale clinical trials. We have to track outcomes. We have to track safety. Right? We have to look at the different indications, right? It's not just one medicine for one person, and maybe it's a combination of therapies. So we improve outcomes for people, well-being for people. We track the healthcare economics on that. Then we work on a new insurance paradigm. We get to change the paradigm on the insurance reimbursement.
The proper infrastructure that's badly needed for this industry.
And we are working within the government agencies, and then we're pulling on experts from disparate technologies or spaces and saying to come together, help us solve this problem, kind of like a moonshot project. And, break down the silos, pull together experts and say, how do we address this problem?
Are you having some notable conversations with
yeah.
I imagine.
I mean, it's extraordinary because it feels like in society, you can all feel it. We're all struggling somehow.
Yeah.
It's either personally, somebody in our family, or somebody that we know.
The big question is that how does this industry advance, become full-fledged commercialization, and how do you balance that with what I'm seeing right now is the capital markets side, and then, indigenous communities. It's like, how do you balance that out? And then further to that, like if someone were to ask you, like the current financial state in the state of California, are they in a situation right now prepared to give an $8.5 billion government grant, knowing the current financial state that California's in right now?
Yeah, these are all good questions. And so to go back to your first point is it's a big nut to crack.
Yeah.
It's a big problem to solve. But what I'm feeling and I'm seeing is there is enough concern that we have that things are broken. And I want my part of what I'm doing is I think I can help fix a small piece of this very broken society we're living in right now. And part of it is how to deliver mental health care and well-being to us.
Right.
How do we teach each other? And how do we empower the person to learn how to take care of their own anxiety or their loved one's anxiety? We're not talked about that.
Yeah. Do you think that this is a framework that other states could adopt?
Yeah, so, again, the approach that we're taking is so novel because it's not decrim and it's not legalization.
Yeah.
We will, by definition, be able to get FDA approval, which will make it available to everybody in the country for those indications.
Okay.
What we want to do in the long term is continue to do the research, collect the data, so that we can look at best practices and that we can also, because we're educating not only the academic community, but the public, so that we change the political will that happens in Washington, D.C., because when you're a person whose kid is suffering from addiction and you've tried everything and your kid is still an addict, we have this new therapy that happens to be called psychedelic-assisted therapy, and you happen to be in a very politically red state. Yeah. I think we're talking about we're helping your child.
The data doesn't lie.
And the data doesn't lie. And then those people say to their elected officials, we support this. And then the political will of the federal government can open up because we have data to support it. They can say, hey, we've got clinical trials that are very, and then you have the people that are responding to it. Now, I want to come in and just say, don't want to overpromise this. This is not a panacea. It is not a cure-all. We have to set our expectations to be very reasonable.
I think the chilling point is the data that's being produced, though. That
Exactly.
gets people excited.
It is, but I've also been involved with the stem cells, like the promise of stem cells. This takes time. It is not a cure-all. We have to wait and see. We have to do it safely. We have to do it responsibly. It's the Titanic ship that we're shifting. And we are changing course. And you can't just make a quick, hard right. We will do it by degrees, and I'm faster than, believe me, I'm intolerant to bureaucracy and efficiency. So it's not just going to be 1 degree turn in 5 years. We're going to do a lot, but it has to be done methodically. So to answer your question, I think the timing is right. I think the people are starving for something. I think the data is there. I mean, I wouldn't be sitting here if it wasn't from all these amazing, highly acclaimed academic institutions that are doing really good data, showing these extraordinary results. And it's like, of course we need to try this.
Well, I think the most important thing is, and I can see the
no-brainer.
passion, but I think the most important thing is just, we want to show the viewers that can't be at this conference this week some of the people that we're meeting, some of the conversations that are taking place. We're talking about government officials being involved that we're speaking as well, some notable celebrity names, and we've seen that before, but we had 12,000 people there this week at this conference, and it really felt like, it's been a couple of years since they held this conference, but the overall growth the attention that this needs and this current society that we're in, it's becoming more and more of a forefront. But again, you can see the proper infrastructure that's starting to develop to make this actually into a sustained business model as well, which is what you need.
We need it, but it has to be done with a new intention.
Yeah.
Right.
It can't be complete
Capitalism at all costs.
the expense of society.
Yeah.
And that's how we're saying what we're doing in this public-private partnership is that we say we honor the drive for money. And it's intuitive, it's great when we need it. However, it can't be at all costs. So we'll say, instead of you taking 99% of the, profit and getting to, do what you want, we'll say, hey, we want 20 or 30% of that or better pricing to Californians. It has to be more equitable.
Okay. You're giving pricing the community initiatives and giving back to the communities that that are being affected.
So how do people find out? You need signatures, right?
treatcalifornia.org. We want to hear your stories. We need you to sign up.
Okay. And how many signatures do you need?
We need 1 million at a certain point in time. We only have 6 months to do it.
6 months.
We need people to, we need access to through email or text, whatever, so that we can make them aware that, okay, this is the time, we need you to go out and sign. And they have to be registered California voters. But we can accept, we need donations, of course, and we want to send the message. We want people to come to us to share because we believe we are collaborative and all our voices are important, all of them.
I applaud the initiative.
Thank
Dr.
you.
Fontana, I appreciate the time.
Thank you.
All right, this is great.
Okay.
What's up, everyone? So what'd you think of the interview? Are there any more questions you want us to ask? Then leave a comment below on information that you want to learn more of. Make sure to share this video with your network and smash that like button. And most importantly, subscribe to our channel because we would not be here without you. Thanks for watching, everyone.